adult congenital and pediatric cardiology section has been very active, in part because of the increasing number of patients being seen with congenital heart problems. And I'm very happy to be joined by Dr. Cathy Jenkins. Cathy, good to see you. Cathy is Senior Vice President and Chief Safety and Quality Officer for the Children's Hospital in Boston. And Dr. Gerard Martin. Gerard, good to have you here. Thanks very much. Dr. Gerard Martin is Senior Vice President for the Center of Heart, Lung, and Kidney Disease at the Children's National Medical Center in Washington, D.C. Cathy, let me start with you. Tell me a little bit about the Quality Metric Initiative. What is it and why is it so important to the pediatric and congenital community?
Well, it's a wonderful new initiative that we started a couple of years ago. It's called the Quality Metric Workgroup, and essentially what we've done is defined 8 different teams that are defining quality measures and metrics across the entire breadth of adult and congenital heart disease treatment.
Well, when you say quality metrics, I'm sure some people know, but give me an example of what you're talking about.
Well, it's a way of saying really what's important and actionable and things that we should be measuring in the field so that we can improve our practice. So as an example, we've included the nurses in this project.
Right.
And they are very interested in their role in nutritional assessment. So
Super.
They've defined a measure of how well they're doing when babies are in the hospital to be sure the babies are getting all the calories they need as they recover from heart surgery.
And is this quality metric then going to be made available to the larger community, not only the pediatric but the adult congenital group?
The adult congenital group is included in it, and they're defining measures too.
Good.
For their
it's
practice.
Excellent. Oh, that sounds neat. Gerard, tell me, I know that there's been the impact registry has been under development. Tell me a little bit about that.
Sure, Randy. This is, I think, the 3rd time I've been able to come to CVN and talk about the impact registry, and it's on its way. Well, this meeting this year, I've gotten to show preliminary data. Over the last 4 months, we've had 14 hospitals collecting data on a pilot project on children and adults undergoing heart catheterization procedures for congenital heart disease. And we're using this pilot to refine our data collection tool, and we're starting to really see what valuable information this is going to give so that we can measure variance and performance across the country, and then use that variance to define maybe best practice and improve our outcomes in this population.
So you'd be looking at all the things that could vary around not only the procedure but the reporting of it and all of those things?
That's right. So we're looking at the demographics of who's coming in the lab, what type of problems, based upon some really exciting work that's being done at Cathy's Hospital with the C3PO project, which is looking at complications. We've incorporated some of that, and we've and working with our surgeons and the Society of Thoracic Surgeons so that we can match some of our procedures that sometimes are competitive and sometimes collaborative.
That sounds fascinating. Cathy, so the idea here would be that you'd standardize the care so it would be of the highest quality. Is that really what you're aiming at across the spectrum of patients?
I think for certain aspects of care where the community's defined that something's very important, we want to standardize and measure how we're doing around that so that we can hopefully do better.
Yeah. Gerard, I'm thinking about in our own practice, we see a lot of adults with congenital heart disease, but tell me about the scope of the patient population, both adults and pediatrics with this.
So congenital heart disease is the #1 birth defect in children. We have about 36,000 children every year born. And because of the tremendous work of pediatric cardiologists, cardiac surgeons, and all the members of the team, nurses, techs, we now have probably close to 98% survival for those patients. And because of that survival, we now have a growing population of adults, and by all estimates, there are now more adults than children with heart disease.
Which is amazing. I mean, you think about it. So the quality metric and the impact registry is really vitally important as this population pool grows.
Especially for that population where so little is defined.
Yeah,
absolutely.
Listen, thank you both for being with us. This has been very, very good, and certainly I applaud what you're doing. It sounds fabulous. Thanks.
Thank you.
Thanks, Randy.
Mm-hmm.